Greetings for the day. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown color patches on their face. They look like freckle-like spots forming large flat patches. This is nothing but melasma. Melasma is a common chronic skin condition in India, and according to study conducted across 4 Indian cities, reveals that more than 80% of the population present skin color heterogeneity on the face, irrespective of their age and gender. This heterogeneity mainly results from hyperpigmented spots and melasma. Indian skin tone is more prone to pigmentary disorders. It occurs mainly in women 90% and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65-year-old women present a facial melasma. Now, melasma and hyperpigmentation generally ignored as sign of aging and often misunderstood skin conditions. Melasma sufferers have been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustrating setback in treatment. So, to avoid all these hassles and to keep you informed, today we are here to know about the management of melasma from an expert. We have with us Dr. Pallavi. Dr. Pallavi she has done her MD in dermatology from MAMC Delhi. She is the distinguished founder and consultant dermatologist at Vijaya Skin and Bone Clinic in Hubli. With extensive training in clinical and pediatric dermatology, she specializes in advanced aesthetic procedures, including laser treatments, PRP, and micro needling. Dr. Pallavi has garnered recognition through multiple awards, including second place in the award paper presentation at Cuticle Delhi and the IADVL National PG Quiz. She has contributed significantly to her field with over 10 publications in international and national journals and has authored chapters in various dermatology textbooks. Her commitment to education and research is further highlighted by her presentation at numerous conferences. Passionate about providing personalized care, she is committed to helping her patients achieve optimal skin health and confidence. A very warm welcome to you, Dr. Pallavi.
Thank you. Thank you so much for having me. Thank you.
It's such a pleasure to have you with us, Doctor. And melasma is such a common chronic skin condition in our society, so it becomes even more important to talk about it. To start with, Doctor, what is melasma?
So, as you mentioned, melasma is a hyperpigmentary condition. So, what it means is hyper means extra, and pigmentation means the color that you see on the skin. So, it is a type of hyperpigmentary condition where you mainly see these very light brownish colored spots on the face. It is most commonly seen here over the cheeks and the nose. This is a very common area where you see. And in some patients, you can also see it over the forehead and even on the chin. So mainly a middle-aged female who presents with such a pigmentation in this part of the face, then you must consider melasma.
Right, so this is melasma and the common presentation of melasma. Now, doctor, what causes melasma? Why it's so common in our society to see people with such, spots or patches on their face? Why melasma is so common?
Yeah, so as you rightly said, melasma is very, very common, extremely common. In fact, in everyday OPD, we come across cases of melasma. So there are various causes why melasma can happen. So first of all, the genetics of Indians, we are prone for pigmentation. So when it comes to pigmentation, we classify the skin into various types depending on the extent of pigmentation. And we Indians fall in somewhere in category 3 and 4, which means we inherently have higher content of pigmentation compared to the Americans and Caucasians. So that itself is a risk factor. When your skin inherently has a higher amount of pigmentation, you are prone for more pigmentation. So that is one thing. And the second thing is of course genetics. So if your mother or sister or anyone in your close family has this history of melasma, then it is quite likely that you might also end up having melasma. And then the another cause is the hormones, especially it is more commonly seen in females because of the female hormones. So one condition where you can see melasma commonly is during pregnancy. Okay. And also women who are on oral contraceptive pills, which are again nothing but hormones, they are also likely to get melasma. And also in postmenopausal women, some of them are put on hormone replacement therapy. So these patients are also prone for melasma. So genetics, our Indian skin, then hormones, these are the main factors. But another one more important contributing factor is the sunlight. Okay, so our skin has got a cells called as melanocytes. These are the pigment producing cells, and these melanocytes they are highly sensitive to sunlight. So, when the sunlight falls on these patients of melasma who already have active melanocytes, sunlight tend to worsen it. So, those who are involved in outdoor activities, those who are constantly traveling, so they are also prone to develop melasma.
Right. So melasma is quite common in our society, and these are, mostly the caused and one of the major culpritors also the sunlight, the radiations coming or by sun. Now, doctor, because we are talking about melasma, there is another term called hyperpigmentation. As a layman, we are more used to hyperpigmentation. Melasma is not a very, often used word by laymen. So my question to you is: are these two different things, melasma or and hyperpigmentation, or are they the same?
So, as I mentioned, hyperpigmentation is a common term. It's an umbrella term. So, it
Okay.
includes so many conditions, and one of them is melasma. So what is peculiar about melasma compared to other hyperpigmentary condition is it has a very specific type of presentation. So it is more commonly seen in females, more commonly seen in the middle age group, and more commonly seen in this part of the face. So there are some peculiar factors about melasma. And one more thing about melasma is it is usually active. So what I mean to say by that is the disease it remains active for some period of time, at least for few years. So the treatment of melasma also differs from other type of pigmentation. So if I have to tell you the other causes of pigmentation, you might have seen some patients who have pigmentation only here, only in the forehead part, and some have pigmentation only on the nose. And some patients, they might have had acne or some kind of skin condition in the past. And once it heals, it will leave behind pigmentation. So these are all different causes of pigmentation, and melasma is one of them. And also some patients who have got, hair dye allergy. Sometimes they develop rashes on the face because of the allergy. So when this allergy heals, again, even that can leave behind pigmentation. So it is important to understand whether the pigmentation that you see on the face, whether it is melasma or any other kind of pigmentation, because the treatment is also going to vary. As you said, melasma is so common and people are so much aware about it. But what they forget is not every pigmentation is melasma, right? So it is very important to identify what kind of pigmentation is it, so that we can treat accordingly.
Right. And doctor, another very important part to understand is that, does it, appear overnight that one fine morning I'll get up and see a lot of, patches on my face? Or do they grow gradually? Because if they grow gradually and initially, while spotting the signs, symptoms, whatever, if we can go and approach a skin expert like you, then there are probabilities that we can, control the whole thing in time. So, please shed some light over that, doctor.
Yeah. So melasma is not something that appears overnight. It's a chronic condition and it's very extremely slowly progressive. So initially, it might look like a freckle. So freckle is this tiny brown spots that you see on the skin, mainly over the face. And again, it also gets exacerbated on exposure to sunlight. So in the very initial stage of melasma, the patient might confuse it with a freckle, right? So they might, just ignore it, just a tiny spot. But over a period of time, it might increase in size. All right, all these small dots will join together and they'll form a larger patch of pigmentation. So again, more commonly, the process starts either over the nose or the cheeks. And as the disease progresses, some patients can develop it over the forehead or even here on the sides of the forehead, on the chin. And in very rare scenario, it can even appear on the neck and hands as well. So if you start seeing these tiny brown pigmented spots on the skin, it's better you consult the doctor as early as possible because you can prevent it from spreading. And also another concern is when you look at melasma, there are different layers of skin, and the skin pigment is dispersed across all these various layers of skin. So there are different types of melasma where you have pigmentation only in the upper part of the skin, and there are certain variants of melasma where the pigment goes even deeper. So when it comes to treatment, the more superficial the pigment is, it is easier to treat. And as the pigment goes deeper and deeper, it becomes stubborn. And these simple creams may not work for the deeper pigmentation. You'll have to go for more stronger treatment. So it is always important that whenever you see pigmentation in the early stage where it is limited, it's better to consult a doctor so that the treatment can be done in time.
Right. So as soon as you spot these freckles, small, patches, please go and consult a qualified dermat. But the problem remains the same. Doctor in our society will first go and consult with our family members, our relatives, our friends. They all come to help us with their prescriptions many a times or many home remedies. Then we have over the counter topical applications. We go and approach a chemist shop and start using topical tube, and we'll keep on using it for months and months. Only when we realizes that nothing is working, it's making the condition even worse. That's when we go and consult a doctor. So, what's your advice on these home remedies, or following someone else's prescription, or go for these over-the-counter topical applications? Do they really help in any way, or they can actually make our condition worse?
Yeah. So as you rightly said, this is extremely common scenario where patient they ask their friends and family members for help. So please understand that whatever creams that are prescribed to you for any skin condition, it is highly specific for that particular condition. If I have given you some creams for some other ailment, that doesn't mean you can put it on the face or any other part of the body for that matter. So I think the audience need to understand that whenever you have a skin problem, please visit a qualified skin specialist before doing anything else. Now there are so many creams that are available over the counter, and they are marketed as skin lightening creams. The problem with such creams is, first of all, it is not regulated, and it contains many ingredients, and these ingredients may not help your melasma, but rather they can damage your skin much further. So most of the skin lightening creams contain a molecule called as steroid, and I'm sure most of you have heard about steroid. Now, steroid is a
Yes.
wonderful drug when used correctly. So there are hundreds of steroids that are available, but only a qualified skin specialist can tell you which steroid to use, where to use, and most importantly, where not to use, right?
Right.
So all these over-the-counter medications which contain steroid, they're easily available without prescription. So what the patient does is they apply this cream on the melasma for any pigmentation or even for acne. So what happens is this steroid, it does give some result for the initial few days. So the patient feels that their skin condition is improving. So they keep on applying. But what they
Right.
don't realize is actually they are damaging their skin. So, if I talk about the side effects of steroids when not used properly, it makes your skin highly sensitive. Your skin will thin out in no time, and you will develop all these patches of redness on the face. You can develop fresh pimples, and as I said, the skin becomes highly sensitive. So much so that you cannot even go out in the skin. The skin becomes sensitive to sunlight. It becomes sensitive to any kind of soap or face wash that you put in, or any creams. If you try to use even aloe vera, it might start burning.
Oh
So
my.
what the audience need to understand is, please don't use such creams on the face, and most of them are marketed as skin lightening creams, and we have seen patients using it for years together, right? So
Right.
they are damaging their skin, the pigmentation is not going away, and after so many years they come to us, to the qualified skin specialist. So what happens at this stage is the skin is damaged mostly beyond repair. So it is, forget about the pigmentation. It is very difficult to manage the damaged skin itself. And also all these home remedies that you were mentioning. Again, we don't know what home remedies we are using. So we are using turmeric or basil or lemon juice and all these things. They are again going to damage your skin because these are not the pure preparation. Lemon juice is nothing but acid. It has a very lower pH. So when you put such thing on your skin, your pH of the skin is going to change. Your skin is going to become extremely dry, itchy, and irritable. And you don't know what you're allergic to. We have seen so many patients who put turmeric and they come to us with burns, right? So again, please don't use all these home remedies. Don't try any of this. Your skin is not there for you to experiment. Please visit the therapist.
Absolutely. It's important to understand that when something happens with any of our organs, other than skin, we go to the specialist. In case we are having pain in our heart or chest, we won't go to a chemist shop for any over the counter medication. We'll probably go to the cardiologist or at least to a physician, to our family doctor. Same happens with other organs. In case you are not, your vision is not clear, you are having problems with your kidney, we'll go to a nephrologist, eye specialist, whatever. But with skin, we love doing experiment, which is definitely not a good thing. Skin is, a reflector. It's the mirror of what's going on inside our body. So make it more, healthier rather than abusing your skin with so many, products. I think a very common misconception we often have is, as Indians, that we don't want to apply chemicals on our face. We want to apply natural things, but we fail to understand that even turmeric has a chemical compound. It has a chemical name. If I tell somebody to have H2O, they'll probably won't have it. If I ask somebody to have water, they'll have it because it's natural. But then water also have a chemical composition. So that is a very common misconception probably we have. We feel that whatever is available inside our kitchen is natural and we can apply it on our face. But again, even if it's so, then nothing is pure. Nowadays, whatever we are eating, applying, nothing is pure in that way also. So it's going to harm us more. So please go to the right person, which is a qualified dermat, in case you have any issues with your skin. Now, doctor, coming back to melasma. Now, as we know, it's quite common in our society. As we now know that women are more prone to have, melasma, especially if you have hormonal issues, if you have a history of melasma in your family, etc., etc. If you are under the sun for long, long times. Are there any preventive measures that we can go for to prevent or at least prolong the appearance of melasma?
So as I said, melasma is not something that happens overnight. All right. So initially you will see all these tiny brown spots. And if you're in the early stage of melasma, what you can do to prevent it is prevent yourself from the sunlight. Now that doesn't mean you sit in the dark whole day, right? So the very cornerstone of management of melasma is using sunscreen. It not only prevents melasma from spreading to different parts of the face, but also it lessens the intensity of pigmentation. If you have, say, light brown colored melasma and if you are constantly exposing your skin to the sunlight, it might become even darker. Not only it spreads in the area, but it also might become darker and it might go much deeper into the skin, which again makes the treatment difficult. So what I suggest is if you're seeing early stage of signs of melasma, then please start using the sunscreen. That is one thing you can do to prevent. And not just for melasma, for any person, it is very important to use the sunscreen to prevent any other kind of pigmentation and also to prevent the signs of aging. And if you're someone who is undergoing any kind of hormonal treatment, then again, as I said, it is a risk factor for melasma, then you might want to protect yourself from the sun.
Right. Now, as you said, Doctor, melasma is quite common during pregnancy. We see a lot of pregnant women with melasma. Does it, fades away after delivery or postpartum, or it stays permanently? And in case it is there during pregnancy, as we know that during pregnancy, over-the-counter medication, application, etc., can be really, really hazardous. So, what's your advice to those who are watching it, who are pregnant and have melasma issue?
Also, during pregnancy, because of all these hormonal changes, yes, you're very likely to get melasma. Now, this can be one scenario where you are having melasma for the first time during pregnancy. It's called as cloaca. In most of the cases, it tends to fade away after delivery of the baby. But what happens is if you are already at the risk of developing melasma, which we discussed in the earlier part of the session, then it is possible that it might continue even beyond delivery. Then that is the time when you need to get treated. Because what happens during pregnancy is because of the physiological state, there are so many treatment that you cannot use during pregnancy because it affects the baby. That's the reason. So the treatment for melasma, that is melasma during pregnancy, is quite limited, right? We have only fewer options to treat. So what you can do is you can wait until the delivery of the baby, and then just see if the disease is going to persist or it is fading away. So if the disease melasma is persisting, then there are many treatment options that you can go.
Right. When a patient comes to you, doctor, with melasma, are there any tests that you normally recommend, or just by clinical investigation, taking history, etc., is sufficient to diagnose?
So for a qualified skin specialist, you don't need any test as such to diagnose melasma. The moment the patient walks in, you can make a diagnosis. But what happens is there are certain hormonal conditions which can be associated with melasma. Apart from the physiological conditions like pregnancy or consuming OCP, some patients can also be having PCOS. Underlying PCOD can be there, and some patients can also have thyroid disorders. So, if you have melasma and you have taken proper treatment and still, the melasma is persisting, then that is an indication that something else might be going on in the body. So, your specialist will advise you when to get these tests done. Otherwise, on a day-to-day clinical basis, it is not necessary to perform any test. Just the clinical examination is more than enough to diagnose melasma.
Right. Doctor, sunscreen application is so important, right? But still, in our society, 67%, 70% of the population is not using sunscreen as a regular thing, as a routine thing. We mostly feel that whenever we are going out, stepping under the sun, is when we require to use sunscreen. Rainy season, winters, we don't need because sun is not there, probably. Please shed some light over the topic of sunscreen and also sunscreen as an effective preventive measure for melasma.
So yeah, it is true that we do think that sun is not there during rainy season or winter. But the only time when sun is not there is during night. It is there all the time, even if it's cloudy or winter. So what
Right.
the general perception is, only when it is sunny, the sun is there. That is the perception, but that is not true. And many patients think that we are indoors, so there is no need to apply sunscreen. But what actually happens is even when the window is open, when the sunlight is coming in, that itself is enough to affect your skin, at least in the long run. Right? It may not happen, the effect may not be seen in day one, but in the long run, yes, it does affect both for pigmentation as well as for the signs of aging. And whether it's cloudy, whether it's winter, summer, whether you're indoor, outdoor, it doesn't matter. Everybody has to apply sunscreen. There is no debate about it. And one more thing is about the reapplication of sunscreen. What many people do is they apply sunscreen once in the morning and then they forget about it. No,
Hmm.
that doesn't work that way. Ideally you need to apply at least once in 3 to 4 hours. If that is not possible, then at least reapply during the afternoon hours because that is when the sun is harsh, right? And apart from that, everyday basis we are using so many gadgets. We use phone. so often. We sit in front of the TV, laptop, and these gadgets can also emit radiation. It is not
Okay.
exactly same to sunlight, but effects are quite similar. So if you are working from home and you're sitting in front of the laptop for so many hours, then again it makes sense to apply sunscreen even indoors. So not just for the melasma, but in general, it is so important to apply sunscreen.
Right. So you should make it a part of your skincare routine to apply sunscreen regularly. Reapplication is equally important. How much amount you take is equally important. Now, doctor, regarding the amount, many a times people feel they will take a very tiny bit of sunscreen and just cover their face. How important it is to take the right quantity? I mean, do we nearly need to make a layer on our skin? What is the right way to select the amount or quantity of sunscreen?
So sunscreen, as I said, it has to be applied in an adequate amount. So there should be a uniform layer of sunscreen on all the exposed parts. So what happens is usually we tend to ignore certain parts, like for example on the eyelids, on the sides of the nose, ears, neck, and even the back of the hand. So these are the parts we tend to forget. So we take a tiny amount of sunscreen and adjust it, accordingly. So please make sure you have to apply uniform layer of sunscreen in all these exposed parts, including the back of the hand. So that much of sunscreen you need to apply. So I know that if you open the internet, you will see these two finger rule and everything. That is okay.
Yeah,
That's a rough estimate. But what the literature says is the amount of sunscreen that is required for the face and neck is slightly more than half a teaspoon, right? So it is slightly more than 2.5 ml. Now you cannot take a spoon and measure it every day. So just
right.
you can approximate amount of how much of sunscreen is required. You can measure it just one time and use the same thing every day.
Right. And after there are so many informations written on the sunscreen tube or box containing the sunscreen. And starting from SPF to boot star rating to PA plus factors, etc., etc. Many times we see mineral sunscreens also. Anything specific that we should consider before buying a sunscreen, especially if we are a patient of melasma or we are at risk of having melasma?
So yeah, we all have heard about SPF 30, 50, and now even SPF 100 has come in the market.
Yeah.
So the basic idea of sunscreen is to protect your skin from the sunlight. And as I said, we Indians, we already have this pigment in our skin, which is called melanin. And this melanin itself, protects our skin from the sunlight. So we already have some amount of melanin in our skin, but that doesn't replace the sunscreen. All right. So what the research recommends is on a day-to-day basis, around SPF 30 is enough. It gives protection up to 96 to 97%. So SPF 30 is enough. But if you are involved in outdoor activities or if you're involved in any recreational activity, then SPF 50 is recommended. But if you have some skin disease like melasma where sunlight plays a very important role, then it is recommended to use SPF 50. So to put it in a nutshell, SPF 30 is good enough, but SPF 50 is better. Don't go beyond 50 because it will only add to the cost of the sunscreen, but it will not give you any additional advantage.
Hmm, right. So use sunscreen on a regular basis, make it, your routine, and also choose the right kind of sunscreen. And in case you have doubts or you're confused what to go for, please go and consult with your dermat. They'll help you in choosing the right kind of sunscreen for you. Now, doctor, what happens, when we are going out or when we are going for a vacation, if we are going for a beach vacation, we make it a point to carry a sunscreen with us and we do that. But when we are going uphill in the mountains, trekking or vacations, whatever, we normally don't keep a sunscreen, claiming that it's going to be pleasant, it's going to be snowy, so there is no need of carrying a sunscreen. But then we do see people who reside there with a lot of pigmentary issues on their face. So is it important to use sunscreen on a higher altitude? It becomes more important to use a sunscreen there.
Absolutely. It is no less important to use sunscreen when you are going for a hike or something, because of course sunlight is going to be there. And if you're talking about the winter or the snowy conditions, it is seen that the snow is a reflector of sunlight. So there is one sunlight that you are directly getting it from above, and also there is sunlight which is getting reflected from this snow. So it is equal and or even more important to use sunscreen in such situations. Otherwise, when you come back from the hike, you will have all kinds of sunburn.
Now, talking about the treatment options, doctor, you have already enlightened us about the diagnosis, what tests are there, or how important it is to, take the history, clinical investigation, etc. Now, talking about the treatment options, doctor, what are the various treatment options available for melasma and how much time they normally take? Yeah, so we are talking about melasma, and we have with us Dr. Pallavi, who's enlightening us more information on melasma and how to manage melasma. Now, one thing is that in case you have a history of melasma in your family, you have hormonal issues, or other factors are equally there. Please start using sunscreen regularly, religiously. That's really important. Reapplication of sunscreen is equally important. Choosing the right sunscreen is also important, because what happens, when you don't choose the right sunscreen as per your skin type, as per your skin condition, and what happens, you'll find it your skin sweating after applying the sunscreen, or many times, there is a very dull patchy look on your skin, which is not very cosmetologically good. So, in case you want to avoid all these, you can go and consult with your doctor. They'll help you in choosing the right sunscreen. Welcome back, Dr. Pallavi. What are the various treatment options available?
Yeah, we were discussing about the treatment options. So one is the preventive aspect, which we already discussed. And then when it comes to the proper treatment, now you have various treatment options available, starting from the creams to oral medications to different in-clinic treatment. Now, when it comes to creams, of course, one is the sunscreen, which is non-negotiable. And then there are so many depigmenting creams that are available. Again, some of them are available over the counter, but please do not use them by yourself. Visit a qualified skin specialist who can choose this ingredient which is best for you. So there are so many things that are creams that are available. Some needs to be put in the morning, some in the night, or some once a week. So your doctor will be the best guide to tell you about that. And then there are certain tablets that are available. Please don't take these tablets very casually, because they have got a specific action in your body, and so many things needs to be considered before taking tablets. And so don't please use it by yourself. And then there are some in-clinic treatment. Now, this is a very important part, because melasma is quite stubborn and it's a chronic condition. It is not going to go away in a couple of weeks. And using only the creams and only the sunscreen will take a longer period of time for your melasma to resolve. So when it is coupled with certain treatment, then it can give you a better results and quicker results. And it will also help you in maintaining that remission for a longer period of time. So again, you can visit a, skin doctor in a specific skin clinic, so that they can customize this treatment for you. Now, one problem that arises here is nowadays we have seen a lot of salons. They also claim that they treat all this pigmentation, they use lasers and all of this. Now, please understand that these people are not qualified enough to use this treatment. These are medical grade treatment which are properly researched and they are backed with evidence. So, a qualified doctor who has studied for 10 plus years versus a person who has done some course of 2 months. Now you have to be intelligent here to choose where you should get your treatment done.
Right. Very, very important point. raised by Dr. Pallavi. Actually, what happens, because we as women are so frequently going to various parlors. The parlor wali auntie will tell us that, I have a facial, or I have, qualified enough to treat your melasma. But please don't fall. Don't fall for quackery. Don't fall for anything. Go to the right person. See, again, in case something goes wrong with your organs, other organs, we go to the right person. In case there is a surgery required, we'll go to the specialist of the best hospital, best, we will do a lot of R&D. But again, with skin, again, we go so, maybe lenient. That should not be the case. Please don't risk it. Go to the right person, which is a qualified dermatologist, a board certified dermatologist. I mean, there are various certificates that doctors do have in their clinics. So go get it checked and go to the right person again. Now, doctor, because we are talking about the treatment plan, and one very common question people often ask, and I'm also getting so many questions regarding that. Does melasma go away forever, ever and ever, or is it going to stay with us in some form?
So the answer is, partly yes and partly no. Let me explain how it is. So if the melasma is treated adequately, then yes, it is going to go away. But as I mentioned earlier, you need to take certain preventive measures so that it doesn't come back, right? So in the beginning of the treatment, we might prescribe you a couple of creams along with the sunscreen and some treatment. So this is like an aggressive treatment in the initial part of in the initial phase of your treatment, so that the melasma goes away completely. So once you are in remission, once the melasma has gone away, you might have to use certain maintenance treatment, which of course includes your sunscreen and then maybe one cream to the max, and some maintenance sessions of treatment you might have to do so that the melasma doesn't come back in the long run.
Right. One common practice people do is that, for example, I'm your patient. You have given me a prescription for 3 months. I'll follow it for 1.5 month probably, and then stop it because I see, betterment in my condition. I won't keep the doctor in the loop. I won't inform the doctor. I'll just stop it by all by myself. Again, when I see, the patches growing, I'll go because I have the prescription now with me. I'll go get the medicine, start it all over again. I'm sure your patients also do it. What's your advice on that? Is it a good thing to do, or we need to follow the prescription?
Yeah, definitely you need to follow the prescription. Now, as you rightly said, what happens is there are two scenarios. One is melasma is quite stubborn. It doesn't respond in 1 or 2 days. It is going to take a long time. So what happens is with patients, they use the treatment for say 2 weeks or 3 weeks. They see either no improvement or very minimal improvement. So they just stop the treatment and they either switch the doctor or they go to a salon or something like that. So you need to be patient at least in the first few weeks of treatment because melasma is going to take time. There is no doubt about it. And then the second part is once they start seeing the improvement, say after a month, month and a half, or 2 months, they tend to stop the treatment. Now, this is the most common cause why melasma comes back. It is not that the melasma is not going to go away completely, but the problem is you're not treating it properly. You're not following the instructions properly. If you think that the melasma has gone and you have stopped the treatment, then definitely it is going to come back. So if the doctor has prescribed you, say for example, 3 months of treatment, then please follow. Please complete that course of treatment and go back to your doctor for follow up so that they'll advise you what to do next. Please don't stop it by yourself. Now that is, the biggest mistake that patients do when they undergo treatment for melasma.
Right. And doctor, before we conclude the whole session, any take-home message for our viewers?
So the most important message that I want to give is melasma. Yes, it is quite common. So please don't be disheartened if you develop melasma. And the second most important thing is please don't ask your family or friends or go to the salon to get the treatment done, or don't use any over the counter product. Now there are so many things that are available online. Just with a click you can get the cream delivered at your doorstep. Please do not use that because rather than treating melasma, you might be actually worsening the melasma, or you might be damaging your skin. So please visit a qualified skin specialist so that they can guide you.
Right. So please visit a qualified skin specialist and trust your doctor. That's really important. Thank you so very much, Dr. Pallavi, for joining us and making this session so informative. Thank you so very much once again.
Thank you. Thank you so much. Thank you so much.
Thank you, Doctor. It was a pleasure having you. Viewers, thank you for your active participation. Stay happy, stay healthy, stay spotless, and stay connected with us. Have a great day ahead.